So today I'm going to talk to you about what progress monitoring is and why it's important. So progress monitoring is sometimes called outcomes monitoring, sometimes called routine outcome measurement, and it's a process of regular assessment of clients of their progress as they go through treatment using psychometrically sound instruments. Typically, how it happens is that clients answer questions prior to the session, and the therapist gets a report based on their answers about their current state. And the therapist gets the report prior to the session so they can look at it and begin the treatment that day, knowing how the client is doing at that moment. The therapist then uses the information to guide treatment, to change or modify interventions if that's necessary based on what they learn from the instrument. It's best also if the client sees the data. So if they also get to know about their progress, if they get a chance to look at a graph or some information from the report, the research says they actually do better when that happens. It's a way of providing regular and reliable data on which to base treatment decisions. And there are a number of different systems for doing this. Quite a few of them are online, and they give instant feedback. So literally the client can come into your waiting room, fill in the measure, press send, and in the next moment, the therapist can print out or get on their screen a report that they can consult or share with the client. It's important to emphasize that progress monitoring tools are just that. They're a tool. They're an adjunct to clinical treatment. They're not everything you need, but they allow you to have something in hand that allows you to monitor client progress in a regular way. It's important to think about when you're going to use progress monitoring. So in general, these instruments are more than just pre-post instruments. They're more than a tool to find out if the client came into treatment and benefited across the course of treatment. Of course, that's an important thing, but these are tools that can be used session by session. So they allow you to look at not just how clients did across the course of treatment, but how they did as they go along. So of course, if you're going to know that, you have to measure on a session-by-session basis. And if you like, the metaphor that I like to use to think about this is if you have diabetes, you measure your blood sugar you measure your blood sugar levels regularly in order to monitor and to adjust your food intake, perhaps, or to know if you need more medication. Progress monitoring tools are just like that. You measure regularly to see how you're doing and to make adjustments as you go along. Probably early treatment is the best time to use these measures because the research indicates quite convincingly that patients who don't do well in early treatment are at greater risk for premature termination, or alternatively, if they stay in treatment, for poorer outcomes. So it's particularly important that we have these tools at our disposal early on in the treatment. Finally, why is it important? Well, one of the best reasons, not necessarily the most moralizing reason for therapists, but as therapists, we're really bad at assessing client deterioration. The research says quite convincingly that we don't see clients deteriorating. It's kind of scary, actually. We don't see when they go off track. And the research also shows that progress monitoring can reduce by half the number of patients who deteriorate in treatment. That's an important number. We also have systematic reviews and meta-analyses that show a consistent association between the use of progress monitoring and better client outcomes. And finally, if you want to think about yourself as an evidence-based practitioner, progress monitoring is an evidence base for your practice. It's not an empirically based treatment. Rather, it's something that you use all the time to collect data on your clients. Of course, it's very difficult for practicing clinicians to stay current with all the research that's out there on psychotherapy, but it is possible to stay current with what's happening with your client session by session. So it's a way to ensure that your practice is evidence-based, that you're collecting and examining evidence at every session and using it to adjust your treatment of your client.